Did that shock you, or did you think I'd made it up? Did you think it was fake news? Well, that should give you a clue. Whilst it's an absolute tragedy that members of our health services are dying from coronavirus, especially if it proves to be from lack of protective clothing, this pandemic has taken our eyes off what's happening in Syria, Iraq, Yemen, and other conflicts elsewhere in the world. How many doctors, nurses, paramedics and other medical personnel have died and are still to die in these conflicts? 4 hospitals were bombed in just 1 month in Yemen. That heading appeared in 2016. But it's now 2020 and still it goes on. How many have been killed since? And for most of them, there's no welfare state for their families to fall back on. Many articles from reliable sources read like horror stories. You can look them up on the internet yourself. There are images which make you weep, especially of children. How did they come to deserve this? Many of these medics work for the Red Cross or the Red Crescent, or Médecins Sans Frontières, which is sort of French for Doctors Without Borders, and other agencies, and continue to do so in spite of the great dangers they face. Most of them are unpaid. How is this pandemic affecting the starving millions in refugee camps in the Middle East, in wars going back decades, and in which we had a major role in starting? Well, we don't know. The media chooses not to tell us. Are the forces involved in these wars up in their game, sort of while our backs are turned? More civilians fleeing their homes, more bombs, more starvation, more torture, and more deaths of innocents, especially women and children, while the rest of the world is distracted and looking elsewhere. Danger is an accepted part of the work which these very brave medical personnel do. Maybe once this pandemic is out of the way, we will be more appreciative of and support not only our own doctors and nurses, but all medical personnel who have risked their lives every day for years and continue to do so, facing dangers we can't possibly imagine. Do seek them out and contribute. Anyway, back to the UK pandemic. Well, it seems times they are a-changing. This appeared on April the 4th in 2020, yesterday. Herd immunity should be considered to end lockdown, the Prime Minister advisor says. Professor Graham Medley, who leads the government's disease modelling team, argued that Britain has painted itself into a corner with a lockdown which could eventually lead to more harm than the disease itself. He told the Times today, "We will have done 3 weeks of this lockdown, so there's a big decision coming up on April the 13th. The measures to control the disease cause harm. The principal one is economic, and I don't mean to the economy generally. I mean to the incomes of people who rely on a continuous stream of money and their children, particularly the school closure aspect. There will also be actual harms in terms of mental health, in terms of domestic violence and child abuse, and in terms of food poverty. Something I mentioned yesterday in Corona 2. And then in today's Sunday Times, April the 5th, the Royal Society is to create a network of disease modelling groups amid academic concern about the nation's reliance on a single group of epidemiologists at Imperial College London. That's Professor Ferguson's lot, whose predictions have dominated government policy, including the current lockdown. It is to bring in modelling experts from fields as diverse as banking, astrophysics and the Met Office to build new mathematical representations of how the coronavirus epidemic is likely to spread across the UK and how the lockdown can be ended. There have been 41,903 cases and 4,313 deaths. Well, I think the government found themselves in a hole, a massive hole, and I think it's all to do with this testing. Despite Matt Hancock's prediction that they'll be doing 100,000 tests a day by the end of the month, I have a sneaking suspicion that they've discovered that that's impossible. In fact, I think they've been told that that's impossible by people in the medical fraternity. I also think that they're finding it incredibly difficult to find the necessary kits and chemicals which have been cornered by the rest of the world. And so without these, they've suddenly realised that this lockdown is going to go on for, well, as long as it takes. And I don't think they know how long it's going to take, other than it's going to be a long time. Now, given the improving weather, and 20 degrees Celsius was forecast for the southeast, are the people, are we going to accept sitting in houses, only able to go out and enjoy the pleasures of late spring and early summer for months? Well, I don't think so. I think that if they try and impose this for, well, as long as it takes, I think it's going to lead to social unrest, putting it mildly. And I don't think they know how they're going to cope with that. Anyway, take care. We'll see you again. Bye-bye.